All right, we are doing the PRP today on my bicep. Amy's going to treat me well. So
do a little blood draw.
So first we're going to draw blood out of this arm, get it into the centrifuge. Then Amy's going to do her magic. And just so you guys know, I never look when my blood gets drawn. That's just my...
It can be a little scary. It can be a little, make you a little dizzy feeling.
That's all good. As long as I don't look, I'm good. Guys, I'm excited to see if this is going to work. It's supposed to. And you guys can see I do have mobility in my arm. It's just sore. I can flex it, but it's just really sore.
Experiencing like the amount of pain that I've seen with bicep tears.
Right.
You're just a strong dude, or
I'm not a strong dude. I think hopefully it wasn't
the way that it ripped.
Right.
It just ripped in a nicer way.
So what Dr. Kumar told me, and I'll just set some on video, because my bicep ripped this way, I don't know if you guys can see, but my bicep is lower compared to the other side. If it went this way, you would have had the muscle go either towards the elbow or towards the shoulder. But it actually is dropped down, and it's kind of hard for you to see, but if I go like this, you can see it drop down. So compared to this, if I put my hand up, you can see my muscles. Amy's doing the centrifuge now. We'll let that do the magic. And then she's going to inject me with my own blood back in for healing.
You can do this all over your body. Knees, shoulders. You can even do it in your face for aesthetic reasons.
So many of you guys didn't know that we do this kind of therapy at our clinic, Anastasis Health and Aesthetics. So, regenerative, all kinds of alternative type of medicine. And just different things that we do here for you guys to understand. So I'm happy that, I didn't want to be the guinea pig, but at least you guys can see it on me. And we'll see how the healing goes. Now, Amy said we typically would do 2 sessions of this PRP.
Yeah, you could possibly need 2 sessions, just depending on how bad your tear is, how much inflammation you have, and how healthy your PRP is. So you've been on a really cool health journey. So I imagine your PRP is pretty healthy right now.
Probably.
But if someone is not an athlete and they have this type of injury, they might need 2, maybe 3 treatments if they're not as healthy, because their PRP you might need a little bit for it to go as far.
Right.
Does that make sense? You can see it's separated from the blood. It's our liquid gold.
Oh, wow, that's really neat.
Yeah.
Can you show that into the camera real quick so they can kind of see? So the clear at the top is what, Amy?
This is your platelet-rich fibrin.
Okay.
Right, PRF.
Okay.
And underneath is the blood.
Got it.
So we will just pull.
That's your liquid gold.
The liquid gold out.
Liquid gold. We have tons of liquid gold in America. Sorry, guys, I'm getting political again. By the way, Dr. Kumar is in the room. He's overseeing, so you guys know he's just back in the corner in this chair. He's doing some work, but he is in the room. He does not need to be in the room, by the way. Amy's fully capable of doing it. She does most of it anyways, but Dr. Kumar wants to see how I'm doing.
Sometimes patients need a little extra.
Right?
It's always great to have a doctor who's willing to just step in and oversee stuff for you as well.
Can you tell based on what you're looking at and color, does it look a certain way? Does it look like the way it's supposed to be?
Yours looks good.
Okay.
Yours is pretty gold.
Okay. That's so neat. So it actually comes out as really like gold looking.
Mm-hmm. Yeah. Yeah. Yours looks good.
Okay. Here's the hard part for me, guys, because I don't like shots. But I'm going to tough it out.
And so we kind of already talked about the worst pain.
Right.
Is kind of in the muscle.
Correct.
In this area.
Correct.
So.
And you guys, again, you can probably see that the muscle has dropped down lower portion.
Yeah. So it, instead of being up here, it's kind of falling down.
It's falling down. So the goal is to strengthen the muscle through the healing process, and it'll allow me to get back to doing, the workouts that I was doing. By the way, I did injure this doing pull-ups. I was just mentioning to Amy before you guys in here, but I felt something a few weeks ago right over here, and I think I must have started tearing it without knowing, and I think just doing the pull-ups just finished it off. So,
Yeah.
but anyways,
Okay, flex that muscle for me.
how much you want me to flex?
As much as you can. Yeah, just
Can I lift my? Whoa.
Yeah, you
Okay.
can use some press.
Okay. Right there where you hit it with your
Right here, that hurts.
Yeah.
All right,
Yeah.
so we're gonna definitely get some down in that area. And I'm gonna give you a little squeezy ball to hold
Okay, good.
in your other hand. Maybe even in this hand if you need it.
This is a big needle. It goes 1 inch into the muscle. So
Yes. Yes, yes. All right. Poke.
ow, that does hurt.
All right, 1, 2, 3. I'm just doing about a half a cc in each of these areas because I want to spread it out and make sure.
Okay.
In the middle here,
Yep,
feeling that?
I sure am. No one likes to get shots, right? But hey,
Yeah, you feel that muscle twitch?
I did. You probably could see that on the camera, my muscle twitch right there. But Amy's great at what she does, guys. So
Can you flex it for me again?
I'm flexing it, but not making a muscle, right?
Yeah, you can make a muscle. I just want-
Okay.
Now I'm just going to go around all of those spots.
Okay. Dr. Kumar, do you want to interject at all?
Yeah, essentially the goal is that you are injecting the PRP to the point of maximal tenderness. So that's where we know that the muscle is torn. And the first syringe, what we do is we inject it on both sides of the tear. And then after that, in a surrounding pattern, we inject a couple of more injections into the surrounding tissue to also help those areas heal.
Okay.
You can see she's going
Ow.
in the second one.
Just a couple.
Okay. You can see I'm squeezing my squeeze ball out. Do you see, guys, see that twitch? That thing just jumped. Ow.
That's how we know we're in the right spot.
Oh, I know you're in the right spot.
Like as easy as that.
That's it. We're done.
Yeah, you're done. And so
It is sore. Now what, Doc, what do I have to deal with now with soreness and all that?
You just take your regular Tylenol and ibuprofen, and then you just leave.
Should I ice it today?
You can, but we just recommend that you don't.
you want to let the PRP kind of really get in and soak in the muscle,
Okay.
start doing its magic. And I would say after about 24 hours, if you have some soreness, you could put a little cold compress on there for no more than 10 minutes an hour.
Okay.
But after that, I mean, other than that,
I think
you're
the pain I'm having right now is more from the injection, actually. That's what it feels like. Just
And
Yeah.
so what's happening is we've taken your own growth factors, concentrated them, and put them into the area that needs the healing.
Okay.
So we've taken your own growth factors and we've put it into that area. And so that's why you're in the tenderness. The tenderness will go away in a few minutes, and then we can.
okay. That's good. Actually wasn't as bad as I thought.
Yeah, you did really good, to be honest. I thought, I mean, if Dr. Kumar was in this chair, we would have heard some yelps.
Yeah.
Then a lot of unparliamentary words.
Yes.
Well, I didn't do any of those.
He really does. He kind of freaks out a little bit when he gets in the chair. He's like, I'm a baby, I'm a baby. Like that means we're going to poke him a little less hard.
I always say that too. Well, guys, thank you for watching this. So now we will continue letting you guys know how I progress with the healing. And Amy, thank you.
You're so
Dr. Kumar,
welcome.
thank you. And we will just keep watching and see what happens. But again, we do this at our clinic. If you have any questions, just give us a call. Dr. Kumar or Amy can just review everything regarding PRP. And we will just take it from there. So guys, thank you again for watching today. And we appreciate you, and we will see you at the next show.
Come see us.
That's right. Bye, y'all.